Hey everyone, welcome back to Hisia Psychology Consultants. My name is Sakina Kalyan and I am a clinical psychologist here at Hisia Psychology Consultants. Today we are here to talk about trauma and exactly how do we respond to trauma. Trauma is an emotional response to any event or situation that we perceive as terrible. Trauma can be either something we have witnessed or something we have observed. It could also be something we individually have experienced. Trauma have long-term effects onto your body, such as experiencing flashback, nightmares, constantly thinking about the event. This is the reason why we say it is important for us to address trauma, because sometimes we can get stuck within trauma. There are various types of traumas that can affect an individual. It's easier for us to understand this through various categories. And the first category of types of trauma can be type 1 traumatic events. These are events that happen out of the blue. They're not anticipated, you never thought they would happen, you never were prepared they would happen, they just happen. One of the biggest examples I can give you within our Kenyan context is the Westgate attack. No one knew it was going to happen. No one anticipated it was going to happen. It happened out of the blue, especially for the individuals who were within that situation. It happened out of the blue. Another example could be a sudden job loss. If you are suddenly made redundant, then it happens out of the blue. You never anticipated that you would be told, hey, thanks for your services, but we don't really require you anymore. You didn't anticipate you'd ever get that talk. So this could be a way of a traumatic event that can really affect you. Another example is a car accident. No one drives on the road anticipating I'm going to crash another car or another pedestrian. So any car accident that really does occur, it is a type 1 trauma. It happens out of the blue. Another category that we can go into is type 2 traumas. Type 2 traumas are now those traumatic events that actually occur from childhood. These are childhood events that can influence you and how you perceive yourself within the world. Some of these examples of type 2 traumas, when I say childhood traumas, could be experiencing maybe a sexual abuse as you are a child, experiencing emotional abuse, experiencing physical abuse, experiencing neglect. So if your basic needs were not met by your caregivers, such as food, shelter, clothing, all these are traumatic events. Another one, which is very important within type 2 trauma, is experiencing a lack of care or a lack of nurture as you were a child. It's very important for us to get the physical upbringings or physical care that we require, but we also need the emotional care, such as love, concern, sometimes even getting a hug. That's all we need. And if you were unable to receive that, you can perceive that as a trauma. Vicarious trauma. Now, vicarious trauma are not traumatic events that you have experienced yourself, but these are traumatic events that you may have heard. I'll go back to the Westgate example because I started from there. Just as we said type 1 trauma was Westgate, type 2 trauma could be maybe if you are not in the country and you are outside a few weeks after that event and you heard about it, you can actually get traumatized depending on the details you're hearing. Now, this is vicarious trauma. You're not experiencing it, but you've heard about it. And that can actually cause some of the symptoms of trauma. Another category is historical trauma. Now, many of us come from a lot of historical backgrounds. This is because we have forefathers and forefathers. Sometimes a traumatic event happening within the time of our forefathers can come to our grandfathers and then come to our fathers and then can come to us. This is called a generational trauma. So a historical trauma is a traumatic event or a traumatic situation or a traumatic experience that has been occurring in every generation within your family. and it's also occurring within you, therefore bringing out certain symptoms of trauma. So one of the last categories of the types of traumas that can occur is called little t trauma. Little t trauma are actually small little events that may happen within your life. They could be anticipated or they could be unanticipated, and they happen for a short period of time. For example, maybe going through a sudden loss, like I said, unanticipated, or you may have anticipated a loss that could happen. God forbid a family member is unwell in the hospital and the doctors have prepared you for the worst outcome. That is you actually anticipating the trauma. It does lead towards trauma, but for a short period of time, but it is anticipated. Another example of little t trauma is maybe moving to a new house. Just because it is a stressful time, it could also be a break of attachment with your previous house that you have had. Maybe you've grown up in that house and then suddenly now you have to move out from that house. So it's a break of those little memories that you've had within that house. And that could be a way of trauma. And last example is losing a job or changing your job. That could actually be again anticipated or unanticipated. But it happens for a short period of time, because the time, yes, you're unemployed wouldn't be that long. And the time you do become employed again, the trauma is not forgotten, but it's sort of you're healing from that trauma. That's why it's called little t trauma. It happens for a very short period of time. After we have experienced a traumatic event, it is important for us to realize how exactly are we going to react to that event. When the event occurs, there are changes that happen within our body. And one of the biggest changes that happens is within the autonomic nervous system, ANS. The ANS actually works together with the brain part required for releasing hormones. Whenever you experience any situation, whether it's happy, whether it's bad, whether it's scary, whether it's not scary, there's a hormone being released, and that hormone determines your response. So even when you are experiencing a traumatic situation or event, this ANS releases or guides your brain to release the hormone required for flighting or for fighting. So remember, there's always a flight or a fight response within a traumatic event. Let's give a brief example. Let's say you're walking on the road and suddenly you're starting to get mugged. Like I said, this is a type 1 type of trauma where it happens out of the blue. You didn't anticipate you were going to be robbed or someone was going to try and rob you. Your body needs to respond to that. So at that time, your body, such as the ANS, will guide your brain to release the hormone for you to either flight or to fight. At this time, you may fight this person. You may push the mugger. You may win this big battle you have with this person. And you may run away. Now, when you run away, as you are fighting, obviously the hormone is being released. As you run away, your ANS has now told the brain, hey, stop releasing this hormone now. She's fine. So the body stops releasing the hormone and you start recognizing what has happened. At times, maybe for a month, you may be a little bit shaken up. You may be a little bit cautious. You may not want to walk alone. You may want to have a friend walking with you. You may be a little bit more aware at the times you're going out of the house, just so that you're safe. However, for some people, the ANS does not stop. The ANS tells the brain, hey, don't stop releasing the hormone, still release it. And this is when the flight or the fight, however you responded, is now on overdrive. So you're constantly fighting or you're constantly flighting, even after the situation has happened. Sometimes they can go interchange. So you may have fought this event, but now you may flight. So from any situation you go through, you may not want to walk alone. So every time you see someone looking a little bit suspicious on the road, you may flight, you may get scared and run away, or you may freeze, right? And this shows that the ANS is actually still releasing the hormone that was required when that traumatic event happened. So yes, you can get stuck within a traumatic event if you actually haven't had the time to process or to sit back and to recognize what happened, how did it affect you, and now how are you taking control over what it did. That's why we say sometimes many childhood traumas that you may have experienced as a child, at that time you're naive, you don't even know they're traumas. But when you come into your adult life, suddenly you recognize them and you remember them. Suddenly you may realize, oh my God, I was actually abused by someone and I didn't realize. Or I did realize, but now it's making sense why I'm scared of this person. This is because this person was actually the person who inflicted that abuse onto me. Be it any type of abuse. But this is when you start recognizing in your adult life about the events that may have happened in your childhood. From your childhood to your adult, what could have happened is you may have suppressed every thought that came down within you. Again, this is linked with your hormone level. If you have constantly frozen in certain situations because of the hormone level, you will suppress it. You will constantly freeze when it comes to a certain scenario and you're not even aware why you're freezing. It's linked with a trauma that happened in your past. If you've constantly ran away or flighted, then you'll constantly run away and flight, but you're unaware why. And if you sit down and you sort of reflect as to why it's happening, or you go for therapy and with your therapist you're able to reflect what may have caused it, you would realize it's actually a trauma that happened in your past. So yes, you can get stuck in your trauma if it is unprocessed. When it comes to healing from trauma, or when it comes to trying to process trauma, it's important for you to challenge yourself to attempt to do it yourself first. You do not even realize, but you are your biggest weapon and biggest shield against any traumatic event. And that being said, it's important for you to sit down and allow yourself to process these thoughts, these emotions, these certain ideas that are coming, these certain behaviors that you've developed. It's important for you to sit down just to process all these. And as you're processing, always remember to speak to someone about it. You can find one of your best friends, one of your friends who you believe is your confidant, and you can sit with them and ask them, this is really happening. If it's an event that you're thinking about that may have happened in your childhood and it's bringing about changes now as you're an adult or an adolescent, sit down with your parents or sit down with your guardian, sit down with your siblings, anyone in your family member you may have been close with, you are still close with, you may have an inclination to what could have happened in your childhood. Sit down with them so that they can clarify certain events that could have happened or could not have happened. This will allow you to identify, is it really what I'm thinking, or is it just a situation maybe I have developed, a perception I have just developed, and it's an irrational thought? If it is, then obviously you need to sit down and ask yourself, is it valid for me to keep thinking like this? Is it healthy for me to keep thinking like this? If not, then this is where you have to change your thought. Another tip that I would like to give is definitely journaling. Journaling has a lot of strength, and there are different forms of journaling. Some people like to draw when they're journaling. Some people like to write poems. Some people like to sing to themselves a song as they're journaling, but they're singing their thoughts and their emotion. So it's important for you to journal, to write down what exactly you're thinking. An advantage of this is we have thoughts going through our mind every split second. And sometimes what I may have thought right now, the 5 minutes back, I've forgotten, or it's just passed by me. So if I had to journal it, I really can't remember what exactly I was thinking about. If it's an irrational thought, you're constantly thinking about different thoughts linked with this one irrational belief. That's why it's important for you to journal it down, because you wouldn't have forgotten, you wouldn't have let it slide. That thing that you're actually letting slide could be the game changer in making yourself realize this is actually an irrational thought. It is not a rational thought. And it'll actually be the one that will help you determine if you're changing that thought. That's why it's important for you to journal. All saying that, if you are unable to cope with certain skills or cope with certain ways that you're trying to heal or process trauma, many of us turn towards unhealthy coping mechanisms, such as turning towards illicit use of drugs or even overuse of alcohol. That is actually an unhealthy way of coping, because just as I explained, in your brain, the ANS releases the hormone during your flight or fight. The same way, Alcohol and drugs also release the hormone that calms you down. So if you are going to use alcohol and drugs to calm you down, you will often not process that trauma, and it will often be stuck. You will often repress or suppress that trauma rather than actually acknowledging the trauma and fighting against the trauma. That's why try and form healthy coping mechanisms. Some could be going to the gym to let off some steam. Some could be talking it out with a friend, going for a run, going boxing. Boxing has a lot of help. Sometimes I tell clients, put the picture of the person who you believe has actually traumatized you, or the situation or the event, on the boxing bag, and you're allowed to punch it. That actually allows you to release that tension that you've been having about this certain event, and then it allows you to sit down and process what exactly is going on. All saying that, if you are unable to go through these little challenges for yourself, it is very, very important, especially when it comes to trauma, to seek professional assistance. We are trained, we are guided inside this profession to help you identify your trigger to that traumatic response, your trigger as to why exactly it's affecting you, and also allow you to start healing from this traumatic event. Remember, we're not telling you forgive and forget. We're telling you recognize and now ask yourself, are you taking charge of your life and of yourself and moving on forward from that event? So if you would like to reach out to us for professional help to guide you through traumatic healing, please do reach out to Hisia Psychology Consultants at 0745 562 109, and you will have a professional, licensed, trained therapist ready to guide you on your traumatic healing process.